And tonight's number, America, is 14 million. Yes, indeed, it is true. 24 million is the number. I missed it by 10 million. Here is a story for you. President Donald Trump and House Speaker Paul Ryan are pushing legislation that would repeal key aspects of the Affordable Care Act. But the Congressional Budget Office, the nonpartisan scorekeeper on Capitol Hill, released its best guess in its official score of legislation, and some of the numbers are quite large. These are the numbers that you need to know. 14 million more people will be uninsured in 2018 under the, the American Health.
Okay, well, what's interesting about the name of it, so it's the American Health Care Act, but there's a very subtle nod that they do in there because they separate the words health and care. And I think that's important because they want you to know this is not going to be health care that you're getting. It's health space care.
Yeah, that's a big deal. And then healthcare, it's one word, healthcare. In the Affordable Care Act, there's no health, there's just care.
So the Affordable Care Act, the more I think about it, I think is a bad name.
I should have been everybody goes to the doctor bill.
Right? Or how about just the American the Affordable Health Care Act? At least then people would know what it is, right? Like Affordable Care Act, if you say that, it's not clear what you're talking about.
And the other problem here is that a third of Americans don't know the difference between the Affordable Care Act
and
Obamacare. I think it's two different things.
And they're like, oh, great, we're repealing Obamacare, but I get to keep my Affordable Care Act.
Right, now more details on this, right? Yep. So 21 million more people will be uninsured by 2020, and 24 million people will be uninsured by 2016. Now herein lies the problem with the Affordable Health Space Care Act. Problem number one is it tinkers with the subsidies, right? So it gets rid of subsidies in exchange for tax rebate, or basically, a tax refund for that amount of money. And I'm okay with that. I'm actually okay with exchanging subsidies for tax refunds because I think, hey, listen,
it's just
you're
a matter
getting
of
the
how
money.
You do it, right?
It's how you get your money back. But herein lies the problem with it: is that they're cutting the subsidy, which is what makes it so dangerous. So usually, when normal family would get, there's the numbers. The numbers are shocking, right? But a normal family would get a certain amount of money. That money is literally being cut in half, right? So the average person in the individual market would be 20 to 25% lower. So here's how it would work out, right? So under the Affordable Care Act, or under the Affordable Health Care Act,
American Health Care,
whatever, right? If you are young, if you're age 21, then your premiums would go down 20 to 25% lower. If you're lower than age 40, your premiums would go 8 to 10% lower. But herein lies the crux: if you are 65 or older, your health care will go up 20 to 25% higher.
Right.
So basically, this bill works if you're young, you never plan on getting pregnant, right? You have a decent job, you can afford the health care premium without the subsidy, or you're rich. If you are young and in college and struggling, you're screwed. If you're sick, Jesus take the wheel.
Yep.
And if you're old, bye-bye.
Yep. Good luck. The numbers that are coming out, this is coming from a lot of it from the CBO poll, these projections and numbers that are coming out, really are painting a picture of what the Republicans were actually attempting to do with this bill. And mind you, they kept this bill under lock and key in a secret room in the halls of Congress, and the numbers are just disturbing.
Right, and what makes it even scarier, right? So the reason everybody's like, well, why are some people going to be uninsured? Now, I'm the first to tell you, I do think there are problems with the Affordable Care Act. Problem number one being is that in a lot of places like Arizona, for example, the premiums are ridiculously high.
Right.
And so are the deductibles, right? So to pay for a plan that you've never had before and know that you have a $2,000 deductible, that's pretty, like a $2,000 deductible for a middle-class family is insane.
Sure.
I think my deductible is insane, and my deductible is only like $500, right? So I agree there. And I think how Congress can fix the deductible is just put a cap on the deductible. It's really simple. Increase the subsidy that are going to people who are poor, who want to get health care, and raising the level, right? So because we know, and here's the problem. The problem is you have companies who have a fiduciary responsibility to their shareholders managing people's health care, because health insurance isn't health care, right? So what you got to do is One is regulate these damn companies,
Sure.
these insurance companies, and say, hey, listen, you've got to come down on deductibles. And on top of you coming down on deductibles, we are going to, or either that, or we're going to subsidize deductibles with a larger subsidy that you get for healthcare to offset this $2,000, $3,000, $5,000 deductible. But the reason why this new Paul Ryan bill is a no-go for folks in the middle, number one, is because of how it deals with Medicaid expansion. So in a lot of states have made the choice to expand Medicaid. Republican states and Democratic states together have made the choice to expand Medicaid because they realize it benefits their population. So we're talking about Alaska, we're talking about West Virginia, we're talking about Indiana, we're talking about New Jersey, we're talking about Arizona, where this money really allowed them, Kentucky, where this money really allowed them to help people who are really poor get health care. And the problem is when poor people don't get health care, the whole system is whacked.
Right.
Because then they have what I like to call emergency room care, right? So instead of I have a pain in my shoulder, instead of saying, okay, I'm gonna go to the doctor and get an x-ray, and you realize you have a broken shoulder, and the doctor fixes it, by the time they go to the hospital, the shoulder's broken, it's infected, and they gotta have a full-fledged amputation, and they can't pay for it. And that saps the system. And that means for the rest of us, our healthcare premiums go up. Right? The more people that have health insurance, the lower your premiums become over time when the health company's not taking you over. Right? So now back to why it goes up. So under the Affordable Care Act, people got a penalty that was paid to by the federal government if you didn't get it. So without the penalty that people paid under Obamacare, fewer folks would buy health insurance. Later, the uninsured rate would rise as federal funding shrinks to states changing Medicare rules because they're going to give you these block grants and states could do whatever they want to do with them, but the block grant's going to be less money. That means the state's going to have to come up with more money, and the states don't have more money, so they're going to cut benefits. And then the uninsurance rate's going to go through the roof, right? And more people are going to be sick. When people are sick, it doesn't bode well for this Make America Great Again mantra. Okay? That's why this is Michael Jackson bad, all right? Because it doesn't do what it needs to do to help people who are uninsured. But what it does do is if you lapse in coverage, which makes it crazy, is you pay a 30% premium on top of your premium. And that money doesn't go to the government. You know where that money goes?
Health insurance company.
Back to the health insurance companies.
I mean, and that's basically
those are the winners.
So in Obamacare, one of the things that people frequently complained about was the fact that there were penalties if you were uninsured or if you lapsed in your health care. And this is still happening, but it's putting the penalty into the pockets of the health insurance companies. Instead
of putting the penalties back into the government that could go to funding Medicare.
I mean, let's just remember what's really going on behind the scenes. When you pull back the curtains, and I asked myself, I was reading these reports as they come out, and I was thinking, like, what were the Republicans really doing here? Because, their job is to serve the American people, allegedly. And I was looking at this bill, I'm like, who is this supposed to help? It's rich people, Richard. Rich
people and insurance companies.
Yeah, which, they probably have enough help as it is.
You don't have to go far to realize that, though. So yesterday, and I wish we could play audio in here, but before yesterday, depending on when you listen to the show, there was a town hall with Tom Price, who is the HHS secretary. And he was like, when it comes to infectious disease and, immunizations, I really feel as though the states should just figure out how they want to immunize. And so you say to yourself, you act like we don't have porous borders between states. So that means
that's not really a states' rights issue.
If you have a crazy state like Mississippi, which is just a mess, right? Who's like, we're not going to immunize for polio.
You're going to end up at the state with people with measles and polio.
And you know what they're going to do? Eventually, somebody with measles and polio
to other states.
Are going to drive to Georgia, or they're going to get on a plane with people like me who travel all the time, who don't live in Mississippi. And then we're going to get polio